Hello, I wanted to discuss today how we bridge the gap between the introduction of new technologies, specifically artificial intelligence technologies in healthcare, and reimbursement of those technologies. And it's not clear-cut. My experience and expertise has been in health economics, outcomes research, and reimbursement, which includes the United States, Canada, as well as the European Union. And so there are specific best practices that we can apply from those industries like biomed and also pharmaceuticals to the introduction of healthcare technologies in AI, which is basically intelligent automation. Now, why would this be of value for us? Well, specifically because we know that artificial intelligence and automation using intelligent systems can actually improve decision-making in the long term, improve morbidities and mortality rates. And so what I wanted to speak about was that providers, payers, as well as regulators have tried over decades to decrease the administrative burden in healthcare systems worldwide. And the results suggest that, for example, in the United States, that their efforts have been pretty much ineffective. In 1999, administrative costs accounted for about 31% of healthcare expenditures. Then by 2017, the percentage had increased to about 34%. So what we found also is that the administrative burden, specifically in a pandemic, has gone up significantly, and that the costs are not just financial. Research has equally shown that the current environment may force nurses to spend more time documenting care than providing it. What's interesting is the percentage of provider executives that are reporting significant investments in automation has gone from 47% in 2019 to 71% in 2020. So the case for AI-enabled automation for improving mortality rates as well as morbidity in our healthcare system is something that I think has a lot of value, but we need to separate fad from fact. And so the most important thing that leaders need to do that are bringing in and introducing new technologies to payers, regulators, and executive providers is to integrate and think and communicate clearly about the opportunities that automation presents for the decision maker, the budget holder, and the health system, integrated in a fashion that looks at the clinical value, the health economic value, the economic value, and the humanistic value of integrating and reimbursing these technologies. Now, the obstacles right now to investing or in scaling automation are the following. Staff in general are wary about it just simply because it's intimidating and most people don't really understand what the algorithms can do. So addressing that specific issue in terms of having people that are skilled in communication to simplify it for decision makers is critical. There's also an expertise shortage. There's skepticism that's rampant around technology and whether it can really deliver the results that are necessary. And then there are also undetermined return on investments. And what do we mean by that? Well, budget holders and payers are looking for a return on investment or a cost saving that they're going to see within 3 years or less, because a lot of the fiscal budgets are in a 3-year time frame. So if it's basically a 5-year return on investment, it's going to be pretty hard to sell the value. And so bridging the value between the technology and reimbursement is critical. And how do we do that? So explicit needs and getting to the explicit needs of the decision makers, the provider executives, as well as the providers, but more importantly, the payers who have a fixed budget is critical. And we can't do that when we don't have the soft skills or the trust and ability to understand the customer. And so it's critical for companies to actually have people that have the skills and instrumentality to demonstrate the financial results with the numbers, but more importantly, also soft skills. And soft skills mean building trust. And when you're trying to get someone to pay for something, just like you're being sold, let's say when you go to a mall for a new credit card, our immediate response is to have an aversion to that person. And I think that understanding that that is a gap, a major gap in human interactions and communication is critical and hiring the right people with the soft skills, with integrity, that can demonstrate that what they want to do is build value, and they want to know how to get there in order to build value and to help the budget holders with sustainability, displacing costs in the health system right now that are being affected. Now, this is extremely important with AI automation in healthcare, and specifically in prevention, because prevention is something that we've funded naturally. Historically, we have funded curative approaches, but prevention is something that's long-term. So how do you build that value? And so it's instrumental to build the value clinically, economically, humanistically, but also to have a policy framework that focuses on health policy and policy decision makers and influencers. But the most important thing, I think, here for people to understand is that communication, which is expressiveness skills, and interpersonal sensitivity and ability to use trust as the new equity or instrument for building the value of a dossier and moving technology to reimbursement is absolutely fundamental and imperative.